Hi, I'm Hannah Causseaux. I am a nurse practitioner student at Auburn University, and today we're in the clinic with our patient, Haley. I'm going to be doing my head-to-toe assessment on her. So I'm going to start the exam off, obviously, by doing hand hygiene, and we will be maintaining patient confidentiality throughout this exam. We checked her vitals and triage, and everything was normal. Her blood pressure, heart rate, temperature, respirations, and oxygen saturation. Are you in any pain today, Haley? We also assessed pain. She's not in any pain. Her height and weight are within normal limits, including her BMI. So I would just kind of take a quick look at her as she comes in the clinic. She's generally healthy. She's in good spirits. I don't see any obvious signs of distress. Her speech was clear and coherent during triage. Can you tell me your full name?
Haley Sumner.
Okay, and where are you at right now?
I'm in Bloodstown, Florida.
Okay, and what is the year?
2020.
Good. Who's our president?
Donald Trump.
Okay, so she's alert. She's answering questions appropriately. She's alert to, she's oriented to person, place, time, and situation. So she's A&O times 4. Her skin color is pink. She has a nice skin tone, no flushing. She is very tall and thin in stature. She is healthy appearing and fit. There's no obvious signs of obesity, and as far as her sexual development goes, she's a young adult female with no obvious abnormal development. She's sitting in an upright posture, just slightly slouches in her shoulders. She ambulated into the clinic with a steady gait, so I know that she can move all of her extremities. She's well groomed in appearance. She is dressed appropriately for today's exam, and I don't smell any obvious odors. So we'll start out by assessing some of her skin, and I will be assessing the skin throughout the exam. So, but just in general, I don't see any obvious bruising. There's no hemorrhages. There's no rashes that I can see upon initial inspection. Her skin, like I said, it's very warm and dry. Let me check your nails. I don't see any clubbing of the nails. Her cap refill is less than 3 seconds. There's no cyanosis. And then I would also check her skin turgor, which there's no tinting. So we'll start, we'll move on, I guess, to the head. So I would assess her hair. It is very thick and coarse. It's evenly distributed. I don't see any signs of lice. Let's check your scalp here. I don't see any skin lesions on the scalp. There's no flaking or lumps. Let me feel of your skull. It is normocephalic. It appears to be symmetrical. I don't feel any indentions or depressions. So next we'll start with her face. We're going to assess for cranial nerve 7. Haley, can you smile real big for me? And frown. Puff your cheeks out. Open your eyes against my hands. Good. Can you raise your eyebrows real big? Good. So cranial nerve 7 is intact. Let's check your sinuses. Tell me if you feel any tenderness here as I touch.
No.
Okay. And I will also eliminate the sinuses. Okay, her sinuses are non-tender, frontal, and maxillary, so let's check your TMJ. Can you open real wide for me? Close. Any tenderness? There's no redness or swelling, no clicks when she opens and closes her mouth. Clench your jaw for me. Good. Let me assess the strength one more time. Good. Now I'm going to touch the side of your face with something soft and something sharp. I want you to tell me, close your eyes, tell me if it's soft or sharp.
Soft, sharp, soft, sharp.
Good. So we are assessing right now cranial nerve 5, which appears to be intact. Let's see. I'll do lymph nodes next. So we're going to assess her preauricular, postauricular, occipital. We'll come down here and do her tonsillar, submandibular, submental. We'll do supraclavicular and the cervical chain. Is there any pain or tenderness here when I'm assessing all of these areas? Okay, so no tenderness. All of the lymph nodes are non-tender and mobile. So let's move on to your eyes. I don't see any drooping. Is there any tenderness or pain here?
No.
Okay, close your eyes. Alright, so there's no drooping of her eyelids. Her sclera appears to be white. Her cornea is intact. I don't see any obvious redness or swelling in the conjunctiva. Her lacrimal glands were non-tender. They were not swollen. We would check visual acuity using a Snellen chart. For purposes of this exam, we're going to pretend like she uses the hand chart. We're going to check her visual acuity using the Snellen chart. It's 20/20 bilaterally. For the corneal light reflection test, we would check for direct light reflections in her eye. Okay. And the light reflection is just slightly nasal to her pupils. So next we'll go on and assess cranial nerves 3, 4, and 6 by checking for conjugate movement using the point of gaze test. So follow my hand. Good. And she does have conjugate movement in all of the directions. I don't notice any nystagmus or lid lag. Haley, can you cover one eye for me? And uncover. Cover this eye. And uncover it. Good. This is the cover test, and there's no lateral movement of the covered eye. So we're going to assess pupils for pupillary response. Good, and her pupils are 3 millimeters. They're equally round and reactive to light. And can you focus on this? And then focus here. Good, and they do accommodate. So we'll check vision now by confrontation. So Haley, what I want you to do is cover your right eye and tell me when you can see my fingers moving.
No. 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 No.
Okay, and we would do this bilaterally, and all of her visual fields are intact without any deficits. So I'm going to get my ophthalmoscope, and we'll be inspecting her lens, her retina for opacities, and then we'll visualize the anatomy of the optic disc. So let's see. We'll cover this side. Look straight on the lens. Okay, and using my ophthalmoscope, I see that everything looks normal. The optic disc is round, it's yellowish orange, it's very defined, and I did not see any hemorrhages or exudates in the retinal background. And then also visualize the macula and the fovea centralis. Let's see, let's move on to the ears. So I'm going to get this ready. And then I'm just going to initially inspect and palpate her ears, move the auricles around, and see if I see any deformities. Is there any pain here? I don't see any obvious lesions. There's no deformities or pain with her ears. And I would do this bilaterally. Again, this whole assessment I would do bilaterally. Haley, can you look that way and close your eyes? And I want you to tell me what I am saying. We're going to do a whisper test. DC3. Okay, and then again, we would do the other side. She replies appropriately without any deficit. So I'm going to look in your ears. We're going to do our otoscope exam for the exam. I'm sorry. All right, and upon examination using the otoscope, I see some honey-colored cerumen in there, but no foreign bodies, no redness or swelling. The tympanic membrane was pearly gray and shiny. I did see the cone of light at 5 o'clock and visualized all of the internal structures of the ear. We'll use the tuning fork now to check cranial nerve 8 by doing the Weber and the Ryan test. I want you to tell me, Haley, when I put this on top of your head, if you hear it equally in both ears. Yes. Okay. So that is the Weber test. Now we'll be doing the Ryan that checks hearing as well. So tell me when you can no longer hear the sound. No. No. All right, good. And both of those tests were within normal limits. Air conduction was longer than bone conduction. So we'll move on to the nose. Let's look at your nose on the outside. Do you have any tenderness here? No. There's no tenderness. There's no lesions. It is symmetrical. It's soft and non-tender. So, Haley, can you cover one of your nares for me and take a deep breath in? Good. Other nose. Her other nostril. All right, both nares are patent. There's no occlusions. So again, I'm going to get my otoscope and we'll check the internal structure of the ear, so of the nose. I'm sorry. So what we'll be looking for is be looking at her septum, the mucosa, and the turbinates inside of the ear. Nose. Sorry. All right. And I would do this, sorry, that tickles. I would do that on both sides. The mucosa is red. There's a little bit of clear drainage in there, but the turbinates are non-swollen. I didn't see any nasal polyps. Haley, I'm going to check your olfactory nerve, which is cranial nerve 1. Close your eyes for me, and I'm going to put a pretty common smell in front of your nose, and I want you to tell me what it is.
Alcohol swab.
Good. So cranial nerve 1 is intact. We'll move on to the lips. They appear to be dry, non-cracked. I don't see any edema. They're pink, moist with no ulcerations. Haley, smile real big for me. Say ah. Can you stick your tongue out? Say ah. Good. I'm looking all inside. You can also use a tongue depressor for this part, but I don't see any missing teeth or cavities. There's no gingival inflammation in there. Her palate did rise when she said ah, and her tongue is pink and moist without any lesions. And then you would also visualize these stensons and sublingual ducts at this time. Stick your tongue out for me and move it left to right. Good. There's no tongue deviation, and that's part of the cranial nerve check as well. And on cranial nerve 9, Haley, stick your tongue out and say ah one more time for me. Good. And the uvula does rise midline, so cranial nerve 9 would be intact. We're going to check for cranial nerve 10, which is by swallowing in the gag reflex. We're not going to stimulate her gag reflex for purposes of this video, but go ahead and swallow for me. Good. So cranial nerve 9 is intact. And again, I didn't see any exudates, redness, or swelling in her throat, and her tonsils were present. There was no swelling or abscesses that I could see. So let's see here. Next, we will do your neck. Let's inspect and palpate the neck. It appears to be symmetrical, no swelling, no lesions. Is there any tenderness here?
No.
Good. Can you turn your head this way? Turn left, go back, and touch your chin to your chest. Good. Ear to ear, or ear to shoulder. Okay, good. So I'm going to go ahead and check that range of motion now. She has a full range of motion in all of her, all directions. I'm going to check the carotids. And that is a very strong carotid pulse. Haley, I want you to shrug your shoulders. Good. And turn your head against my hand. Good. So what we're doing now, we would do that on both sides. We're checking cranial nerve 11, the accessory nerve. Now I'm going to check her thyroid and her trachea, and this is done from behind. I'm going to palpate the trachea. I'm sorry, the thyroid. All right, and swallow for me. Good. It does rise when she swallows. I don't feel any goiters or nodules. And then the trachea is also midline, non-tender, with no deviation. So now it's time for our respiratory exam. The thorax. So what we'll do is start on the back first, but in general, I'm watching and I see that she has a regular rate and rhythm of respirations. There's no distress noted. She's not using accessory muscles to breathe. No supraclavicular retractions. So again, we'll start on the back first. I'm just going to inspect. She's not in a gown for this exam, but typically we would expose the back and look for any deformities. I'm going to check lung expansion. Haley, can you take a deep breath for me? Good. And lung expansion is symmetrical bilaterally. There's no deformities or asymmetry. So, Haley, any tenderness back here as I palpate? Okay, good. There's no crepitus, no abnormalities, and her thoracic spine is non-tender. I don't see any malalignment at a glance. No abnormalities or deformities with her ribs. So, tell me if there's any tenderness when I check here.
No.
And there's no CVA tenderness noted. Let's do fremitus. If I could get you to say 99.
99. 99. 99.
Good. There's no decreased fremitus on either side. And then the AP lateral ratio is about 2 to 1. So now we would percuss and then auscultate, and we're going to be doing this in a ladder pattern in all of the different areas. So I'm going to percuss. And I hear resonance throughout, so what I'll do is auscultate now in that same pattern, listening for any adventitious breath sounds. You can just breathe normal for me. And again, I would do that in all of these areas, and the breath sounds were clear in all of those areas. So now we'll move on to the front. Again, we'll do a lot of the same stuff. We'll inspect. I am going to check the costal angle here, which is about 90 degrees. I don't see any deformities on the chest. It seems to be symmetrical rather. Are you having any pain or tenderness here? No. So no pain or tenderness. So what I'm going to do next is go through that same ladder pattern, percuss, and then auscultate again. Sorry. Deep breath. Okay, and again, we do that in all of those areas. I hear equal vesicular breath sounds throughout, and it is resonant. So for females, we would do the breast exam. Obviously, we would expose our patient, but for purposes of this video, we will not. Haley, I'm going to have you raise your hand straight over your head for me, and what we're doing here is we're checking for symmetry, and they appear to be symmetric, and we're going to assume there's no dimpling. So with Haley laying flat, we're going to just kind of palpate for any kind of tenderness. And I'm going to show you how to do a self-breast exam. So put this hand behind your head. And we would just palpate for any tenderness here. And then any tenderness here in the tail of Spence. Okay. And then starting in like a curvy line, working from the outside in, you just palpate this direction towards the nipple and feel for any tenderness, any discharge, any lumps, or anything like that. And while we're at it, we would palpate these axillary lymph nodes. Is there any tenderness in here? And they appear to be non-swollen and non-tender, and they're not fixed. They're mobile. So we would do the cardiovascular exam with her laying in the same position, about 30 degrees. And I would check the jugular vein. There's no distension there, so there's no JVD. Haley, does anything hurt on your chest? We've already inspected it to know that it looks okay. I don't see any heaves or thrills. I don't feel any heaves or thrills upon palpation. We would locate the point of maximal impulse, PMI, is at the 5th intercostal space, mid-clavicular line, and there does appear to be a regular rate and rhythm there. So now what I'm going to do is auscultate. I'll do this with the bell and the diaphragm in all of those cardiac areas. For purposes of this exam, I'm just going to do it with one, but I would do it with the bell and the diaphragm. We would start with the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. And I do not hear any murmurs. There's a regular rate and rhythm. I did hear an S1 and an S2 heart sound. And then I would also auscultate the carotids and the temporal arteries, and I would expect to hear no bruits, and I would expect everything to be equal bilaterally. So again, we would check the carotids and the temporal arteries bilaterally, and those are normal. So Haley, now what we're going to do is check the abdomen. I do need you to lift your shirt just a little bit. For this part of the assessment, we do inspection, then auscultation, then percussion, and we end with palpation. So I'm just going to inspect. I don't see any scarring. There's no rashes or lesions here by looking. Her umbilicus is midline. There's no herniations or redness around it. So what we'll do is assess the contour, which is flat, and then I'm going to auscultate these breath sounds and abdominal sounds in all of the quadrants. We would do this in all 4 quadrants, taking time to make sure there are vowel sounds. Normal active vowel sounds, you should hear about 20 per minute. And then you also listen for bruits in the renal, the iliac, and the femoral arteries. Now I'm going to percuss on her stomach, expecting to hear tympany throughout, which I do. You can also percuss down until you hear dullness over the liver. And then when you start to hear tympany again, measure that liver span. It should be about 6 to 12 centimeters. And then you should hear dullness over the spleen on the left mid-clavicular line. So now we're ready to palpate. We're going to do soft palpation first and then deep palpation. So Haley, just tell me if you feel anything in any of these areas that's tender. Okay, so everything is soft and non-tender. So now we're going to do deep palpation. Any pain here? Okay. I don't feel any masses or tenderness, or she's not tender rather, and there's no major abnormalities. I do not, the liver and the spleen and her right and left kidneys are non-palpable as expected. You can also measure the aorta at this time. And then the last thing we want to do for the abdomen is to check that abdominal reflex. And in all quadrants, what you do is just draw an X, and you'd expect the abdomen to contract, which it did. So you can cover yourself up. We're getting to our musculoskeletal exam. So we're going to check extremities. You can also check inguinal nodes to make sure that they're non-tender, mobile, discrete, and a femoral pulse, which again we would expect to be 2+, brisk. And we're going to inspect and palpate all of the extremities next, making sure that there's no edema, no skin discoloration, that the skin is warm and dry. We would do this on legs and arms. And then we're going to grade the distal pulses. I'll do it on one side for this exam, but again, we would do this on both sides. So Haley, I'm going to check your radial pulse, your popliteal pulse, the posterior tibial, and the dorsalis pedis. And I do feel all of those +2, which is normal. We're going to go on to the range of motion and check all of the joints. The neck, again, we did that earlier. Her range of motion was full, and she pushed against resistance, so that's a 5 out of 5 strength. Sit up for me. Let's check your shoulders. Can you put your arms up for me and down and back? Okay, good. Behind your head and behind your back. Good. Now I want you to pull against my hands. Good. And now resist. Okay. All right. She has 5 out of 5 shoulder strength and full range of motion there. Bend your elbows for me and extend them. Rotate them in. Rotate them out. Now I want you to bend them up. Push against me. Good. Now pull. 5 out of 5 strength there, and her range of motion is full range of motion. We're going to check hands, wrists, and fingers. So why don't you make a fist and then spread them real wide. Bend your wrist down, up, twist. All right, let me check your hand grip. Squeeze my hands. Good. She's got 5 out of 5 strength, full range of motion. Stand up right here for me. Let's check your spine. So what I'll have you do is, let me get right here. I'm sorry. Bend over, touch your toes for me. Extend all the way back. Okay, bend back. Okay, twist at the waist. And bend over, I'm sorry, one more time. Let me check for scoliosis. So at this point, we would do a scoliosis screen and just make sure that everything is midline. And you can also palpate those spinous processes here to make sure there's no tenderness, okay? And then do side to side, this direction. And you can have a seat back down on the table for me. She has a 5 out of 5, or I'm sorry, the full range of motion there. So we'll check her feet and ankles next. If you want to lay down for me, I'll try to pull this off. Okay. So let's point your toes, flex your toes, turn them in and turn them out. Spread those toes. Good. Now push against my hands like you're pushing on a pedal. Good. She's got 5 out of 5 strength in her feet and full range of motion. Bend your knees and straighten them. Good. Bend your knee again. Now push against me. Or, I'm sorry, straighten your leg. Yeah, good. So we are checking for the range of motion. She has a full range of motion and 5 out of 5 strength. We'll check your hips and pelvis next. So go ahead and pull knee to chest. We'll do this on both sides, but for purposes of this exam, one side and straighten. Good. Can you rotate your knee in and out? Good. And then straighten your leg out. Push against me with straight legs. Yeah, that's 5 out of 5 strength. We're checking the hips and the pelvis. So now we'll do your deep tendon reflexes. So I just need you to relax. We'll do the bicep, the tricep, the brachioradialis first. So just relax. Okay, bicep. And then put your arm up brachioradialis. And then let's check the. Oh no. Okay, you're gonna tell it. Okay, ready? All right. The knee, reflex, and the ankle. Sorry. Okay, let's do the plantar. I don't have my table now. Okay, so we're gonna check the Babinski. Okay. Sorry, the Babinski is negative. So now we're gonna do the last thing, the nervous system exam. Again, Haley's conscious and alert throughout this whole thing. She's acting appropriate, even though we're acting silly now. She's followed my commands appropriately. That's her cognitive impairment that's intact. Haley, what did you have for lunch today? Do you remember?
Spaghetti.
Okay, and where did you go on summer vacation?
The beach.
Okay, so her recent and her remote memory are intact. We already checked her orientation earlier. She's alert and oriented ×4. Haley, I'm going to give you something in your hand. It's a pretty common object. Close your eyes, and I want you to tell me what it is. We're going to test the stereogenesis. What's that?
Spoon.
Okay, good. Now we're going to do that same sharp and dull test on your extremities. I want you to tell me if you feel something sharp or dull. Close your eyes.
Soft. Hard. Soft. Hard. Soft. Hard. Soft. Hard.
Okay, so sensation is intact. We'll check the cerebellar and motor function. Haley, touch your nose and touch my finger. Touch your nose, finger as fast as you can. And we would do this on both sides, and her motor function appears to be intact with no deficits. Last thing, we're going to have you stand up. I want you to do a heel-to-toe test here. Just walk in with your heel to toe like that for me so I can check your gait. Good, and she has a steady gait, well balanced. All right, come back here, just stand shoulder width apart, and close your eyes for me. Good. We check this for about 20 to 30 seconds. There's no swaying. It's a negative Romberg test. So the last thing I need you to do is hop for me. We're going to check all those motor functions. Just hop. Yeah. All right. So that wraps up our head to toe assessment. Thanks for your time.